Okay, can everyone see me, hear me? I'm assuming okay. All right.
Yes.
You sound great, Hernan.
Great. Hi, everyone. We do have some people trickling in, but we do have Dr. Shalv and Dr. Ferris here. And so we will go ahead and get started. Welcome, everyone, to University of Chicago's Urology Town Hall. We're happy to have you all here. We appreciate you taking the time to meet virtually, and we hope that you have a lot of questions answered after this and learn more about our program. Without any further ado, I'll give it to Dr. Ferris for her to take over.
Thank you, everyone, for coming to our University of Chicago Town Hall. We're really excited to be here and tell you about our program. We're going to start with Dr. Shalv. Thank you. Dr. Shalv is going to start with presenting a little bit about University of Chicago and our faculty, and then I will talk about our program, and then our residents will take over from there. So I'm going to start with Dr. Shalv.
All right. Thank you, everybody, for the interest. Everybody who joined us, and I know some of our residents are there. I'm very quickly going to give you kind of a quick taste of who we are, why University of Chicago and not somewhere else, and a little more. So the University of Chicago has been founded in 1892 by Rockefeller. You'll see the Rockefeller Cathedral there every day when you come to work. And it's on Hyde Park, a neighborhood that was once a very prominent neighborhood in Chicago. Over time, it kind of declined, and then now with the university there and a lot of faculty living there, it's really flourishing. This university is globally recognized with nearly 6,000 undergraduates and about 9,000 graduate students and professional students. And we are home to almost 90 Nobel laureates, maybe more. And this is very lucrative, as I think only 5 universities in the world have such a nice number. One of them was given to Huggins, Charles Huggins, who was the chief of urology in the 50s. Keep going. That was probably, you don't know, but it was done for discovering the relation between hormonal therapy and prostate cancer. The campus at the University of Chicago is beautiful, mainly in the summertime, but it has very iconic architecture. I'm not going to belabor on it here, but when you come as candidates, I'm going to, describe everything. It's really beautiful to spend your time there when not indoors. Next. And the clinical volume at our section is one of the largest in Chicago. There's a lot of cancer cases, more than 400 prostates a year are done. Bladder cancer, last year we're going to finish with 52. And the prediction is that we have 80 cystectomies next year. We do more than 150 kidney surgeries. We do more than 150 reconstructive surgeries, and urolithiasis is out of the wazoo between all the campuses that we'll do, and I'll talk about the other campus that we have. And in pediatrics also, specifically, we do more than 150 major cases in pediatrics. University of Chicago reached the milestone of the section of urology of 10,000 robotic cases by 2018. And we're the ones that started the program and in Chicago. And now we have 7 clinical robots, 1 SP single port robot. The clinical robots are XIs, and we're leading this effort in the whole Chicagoland. Next. And we also have now a trauma center that opened in 2018. Very quickly, it became one of the largest trauma centers for gunshot wounds. in North America. Very, very busy. Our life has changed a little bit as attendings. We come in a little more. The trauma surgeons are really good. They do a lot by themselves, and they call us only for very, very specific urologic things. The residents get a great experience in trauma. And the interesting thing is that this trauma center was made with a concept of engaging the community and talk about prevention and not just treating the trauma and trying to prevent it. And they have a lot of grants and services that they provide. There's a new emergency room that also opened in the same year, which you'll probably see if you come here. Next. So what defines us compared to other programs? And the bottom line is it's the people. It's the team that we have here of attendings, of residents, of fellows, mid-level providers, nurses, administrative team. What we do, and I lead the effort, is to try and get same kind of people to the program. People that are very, very compassionate, friendly, striving for excellence in patient care, very, very much into teaching and innovation in surgery. And we create this collegial group, and when we add people, and actually when we select residents, this is emphasized very much, that we want people that are good people first, and then good doctors and passionate and capable people. I think what we offer compared to other programs is, number one, the gamut of everything you can be trained in urology is covered. I couldn't say that 4 years ago, but now I can say it. All the missing links, which were fertility, men's health, transgender surgery, we didn't have these things. Now we have everything top to bottom, and we have a very robust community-based training, which really prepares our people, whoever comes here, to do anything they can. One more thing that we are leading compared to other programs is the concept that surgery is changing. And what you learn now, you probably will not be doing a lot when you're out there doing your life's career, with regard to big slicing patients open, doing open, prostatectomies, cystectomies, nephrectomies. It's all changing. And we are very, very much in the forefront of adopting these innovations, the concept of minimally invasive surgery, doing the least we can to disrupt the lives of the patients we take care of, and still achieve the same outcomes as we did in the old ways that we did. So we embraced innovation and moving forward to less and less invasive ways to do stuff. For example, all the prostate treatments, and I'm not talking about only cancer, but also benign, all the novel technologies you learn between us and the other campus in North Shore, the new modalities for focal therapy for prostate cancer, we are leaders in it. We jumped on the HIFU. We have the TULSA Pro coming in. Everything we can do, concepts of active surveillance, that Gleason 6 prostate cancer is really should not be considered cancer and actually treated like something we need to look at, but not actually treated, is actually Scott Egner has been kind of pushing it hard since he graduated his fellowship. And we all go in the same concept of how can we minimize the disruption of a patient's quality of life and life in order to achieve cure or basically management of disease, and not just by all cost, cure the patient and then make him suffer for the rest of his life. So this is something that I think is very beneficial for new residents, because your career will be spent when everybody will get the message that this is where we're going. And instead of just doing the big stuff, they'll be like, hey, I was trained in doing this, minimally invasive stuff, and I can be a leader very early in this and adopt it to my practice. The other thing is we have a lot of thought leaders in their fields. And when you're looking for a fellowship or looking for a job, you're going to have somebody with very, very good connections to help you along to get, what you want, either a fellowship or a job somewhere. And just, the title of the credentials of finishing here your residency goes a long way when you do apply for somewhere else. So I'll stop bragging about ourselves and just tell you a little bit more about our faculty. So Piyush Agrawal is running our bladder cancer program and doing research in that regard, all the clinical trials. He also runs the SEO fellowship. We have 2 fellows a year, one clinical and one research fellow. Next. Scott Egner is running the oncology program for us. He is focusing on non-interventional treatment for prostate cancer, but his surgeries are done on prostates and kidneys. Next. Sarah is running the program, the residency program, but also running now the ambulatory ORs that we have at the University of Chicago. She's also the clinic director for us in urology, but she's going to let it go now that she took the job of the entire hospital ambulatory surgery program. She's leading women in urology and surgeons committee, and does a great job in all of this. On top of it, she's doing a lot of reconstructive surgery in female urology. Mohan Gundetti is, again, a thought leader in pediatric robotic surgery. He's an outstanding reconstructive urologist. But in addition, he adopted, thanks to Dr. Zagaya and a little bit myself, he adopted a robot for children very early on, probably in 2007 or 8. We did the first few pediatric robotic cases and just took it to the next level, and the whole world is looking for him to come and give talks and demonstrate robotic surgery in peds. Next. Irvin is just joined us recently from U of I. He also is a leader in reconstructive surgery, mainly gender affirmation surgery. So phalloplasties is something that is going to be part of your training. Vaginoplasty is going to be part of your training. He does it right and left. And when somebody is invited all over the world to talk and barely makes it, to give all these talks and still do all the surgeries that he wants to do, that they're really up there in the world leaders in the subject that they do. And I think Irving is one of them. Mohan is one of them. Piyush is evolving to this now, and Scott Egner about prostate cancer is the same thing. Next. We have some younger people we just recruited that will very quickly evolve to the same status, because we recruit the best of the best, and Parth Moody is one of them. He's an assistant professor with us, only a couple of years with us from the University of Michigan when he did his fellowship, and he's doing research and bladder cancer with Piyush because the demand is so high. Next. Omer is the one that runs the, he's directing our men's health program and fertility. We did not have fertility until he joined us, and now we're like leading out there. And again, another one that travels a lot, gives a lot of talks, and invited everywhere. And now building a men's health center in downtown Chicago to capture all the professionals that come to the loop to work. And there's actually 70,000 men between the ages of 40 and 60 that are coming to downtown to work on a daily basis. Next. Luke Reynolds is another young recruit that we had from Canada. He's running our stone program and creating a very robust research program with nephrology here, which is very, very strong. Fred Coe is kind of the icon of metabolic management of stones. And Luke is collaborating with all his disciples. And it's a very, very strong and rapidly growing program in the Midwest. Next. I do mainly robotic surgery, but I quickly engaged in HIFU, high intensity focused ultrasound. We just got the TULSA Pro, which is another ultrasound-based energy to treat prostate cancer. And in my younger days, I traveled all over the world, pushing renal surgery, minimally invasive renal surgery, either laparoscopic or robotic. Next. Our newest recruit is Ted Skolaris, who is an oncologist who's going to be focusing on prostate and bladder. However, he will be mainly doing research. He's going to run the research for the entire Department of Surgery. He's coming with a lot of NIH funding. His specialty is health services research, which he's doing not only in urology, but in other subspecialties in surgery. Parth Moody actually is doing this specifically for urology, and it'll be a great collaboration. And he's going to start in October with us. Next. Greg Zagaya is the most experienced robotic surgeon on prostate in Chicagoland, and probably one of the 10, 20 leading in the country with numbers. I think he's approaching 5,000 cases that he did himself. And he also does brachytherapy. And now, I urge the young people to move on and do the innovations and the new stuff and be comfortable with being uncomfortable initially to conquer the new technique. So I dabbled a little bit with the SP. I tell you, it's painful. And I didn't feel like for kidneys, it's the best thing. And probably prostate can be done with it. But now, with a very courageous move, Greg Zagaya started championing it. I have no doubt. He's such a skilled surgeon that if he invests the time and does 5 cases, that did 2 today. He's going to do 2 on Friday, tomorrow. He's going to master it and be, teaching all of you when you come here, single port surgery with the new robot that we have. Next. The next recruitment we want and need is actually a general urologist. Our program is developing, the University of Chicago is developing a lot of offsites. Right now, we're mainly at the campus in Hyde Park, but we're going to have 5 different offsites. I'm not going to go through all of them by end of 23. And this year we were 31. We're going kind of between 35, 28, 31. We're out there, and we're going to try and keep our place solidly as small of a program as we are. Now with all these recruits, we're 11, but we've achieved, 28, 32 when we were only 8 faculty at the University of Chicago. Next. And this is our team. Recently, the residents are in front, and then you see mid-level providers, and then you see the attendings in the back. And we just took it recently, and I'm very glad that it made it to this presentation. Next. This is the team that we work with at North Shore. Very, very, very good collaboration, mainly training and education. 2 residents of ours are training. Sarah will talk to you about it. But the people there are very similar to us. It's ran by Brian Halfen, who is an oncologist, but he's not shy and does a lot of research to do BPH and water evaporation of prostate and so forth, and push the envelope. And he constantly hires new people and innovative people. He tries to focus on people that did fellowships, that almost all of them did fellowships, and only then they're recruited to this group. And we're very proud that they're partnering with us. giving you a very high level training with regard to the clinical skills in a community setting. So that's why when you graduate here, you're the full package. You can fit anywhere you want, in an academic institution with research, or in a private practice, single person, big group, whatever you wish, you'll be ready for it. Next. And that's there. I'm not going to go through it. We'll do it in the. They do almost as much as we do with the faculty that they have. Next. Oops. Everybody that comes and joins us has to complete a half marathon. Otherwise, I'm not giving you the residency certificate. And if you don't do that, you at least join us for bike rides of about 30 miles on weekends, about 6 times during your residency. And if you can't do it, I think it'll be tough to graduate you. Next. That was just to tease you. All right, thank you very much, and let's move forward.
Thank you very much. So I'll be talking next about our residency program. So I'm Sarah Ferris. I'm the Urology Residency Program Director here at University of Chicago. And I'm very, very proud and excited about our program. As Dr. Shalov mentioned, we've had a lot of changes I think all for the better over the past 2 years, with wonderful faculty recruitments who really round out our program. We cover all aspects of urology now, between men's health and infertility and gender affirmation surgery, reconstructive urology, oncology, stones, and pediatrics. We cover all different areas over the 3 different campuses. Our residents truly become proficient in management of the simplest to the most complex urologic cases, and they're highly competitive for fellowships or joining a practice. And I'll run through some of our graduated residents a little bit later. We accomplish this through a congenial, respectful, and fun environment. I really believe that this is a fantastic place to train. Our residents and faculty truly get along and have a really good relationships with one another. And so these goals, our goals really correlate with our strengths. So we really want to provide some of the best available clinical care possible for our patients. And along those lines, train the most capable and compassionate urologic surgeons. Some of our other goals are to train leaders in the field of urology. We have many experts here, and we want you to be able to go on and have a bright future in whichever area you choose. We're also really developing our research program, and so pursuing discoveries and new knowledge is a goal of ours. And enjoy the journey, but work hard and play hard. And it's a wonderful group to be a part of. People definitely spend a lot of time outside of work together, we'll put it that way. So what are we looking for in residents? Dr. Shalov has a saying of having fire in your belly. So we want residents who are hungry to learn and really dedicated. Residency is a time for you to be exposed to everything and to have access to people teaching you and helping you to hone and develop your skills and your knowledge. And so we want you to come in hungry and ready to work every day. And along those same lines, teachability. So I think being open to learning things and feedback and developing your skills as a surgeon and as a physician is very important. Within any residency program, there also should be interest in teaching. So our chiefs do a lot of teaching of our junior residents, and our residents do a lot of teaching in medical students. So I think anytime you're at an academic center, it's important to be interested in teaching and passing on your knowledge. Having interest in curiosity and research, we're really developing our research arena, and I think we want all of our residents engaged in research. And so having an active interest in projects, and we'll be working to help you to find research that interests you. A hard work ethic, of course. being open-minded and having a desire for self-improvement. So that gets into that teachability. We also want you to develop a reading program so that you can really learn and help you to become your best self. A team player is incredibly important for this group. One of the things that I find one of the most impressive things that I find about our residents is how well they get along with each other, but also how much they help each other out. So I'll be finishing up a clinic and I'll be like, hey, I hope you have a good night with my resident who's been working with me. And they'll be like, oh no, I'm gonna go check in. I've got to go help out with this consult, make sure so-and-so is okay. So they really do help each other out in an incredible way that I think is very, very unique to University of Chicago. Diversity is also very important to us, and I'm going to touch a little bit later on all the different areas that we've been working to maintain diversity within our group. So for your development, I am very vested in your long-term development as compassionate clinician and surgeons, and our faculty are very involved in this and invested in this as well. I think a real strength of our program is that we're going to give you excellent progressive autonomy to enable you to practice independently. So I've had incredible feedback from private practices and fellowship directors just talking about how well trained our residents are and how much they like having them, and to please keep sending them along, which I feel like is a very high compliment for our training program. And we want to help you to obtain your career goals. So my educational philosophy is we want to have the best program possible. And we've made a number of changes and improvements the past couple of years. And I really want to be able to improve the program. And this is through your feedback. So I really value resident feedback and their input, which helps me to implement kind of resident-driven programmatic changes. We meet as a group once a month to run through how things are going. And so I can help make sure that your experience is as smooth and going as well as possible, but also to figure out areas that need to be improved to really enhance the residency program. I'm very open to new ideas and flexible with changes in the program. So if we do make changes, generally nothing's set in stone. So I'm constantly asking and making sure that they are beneficial as we go forward. And I really respect your autonomy. I understand that everyone learns differently, and I want to work with you to develop the best educational system for you to help you develop into the best urologist you can be. Your well-being is also very important, and I don't think anyone can function at their highest level without being in a good place. So it's important to us that we have this to help you achieve your full potential. As I mentioned earlier, diversity and equity and inclusion is very important at University of Chicago. Our Department of Surgery is really leading the way in this. There's a very strong commitment. We actually have a dedicated vice chair for our DEI within the Department of Surgery, and a steering committee that's really focused on self-assessment, programming, and advocacy. And they're working hard to remove barriers to healthcare access and to also provide the best care for our community. Some of the things that we've done just within our urology program, we participate in resident recruitment at the SNMA and LSMA resident recruitment fairs. We're in the process of developing and adopting new lactation and parental leave policies for our program. We have a new women's surgeons committee, which is interdepartmental with resident-specific events for women surgeons to help them to develop their careers. And the Department of Surgery has a new Ulysses Grant Daily Surgical Society for URAM mentorship for our residents that we're very excited about. That's just come out this year. So getting into the nitty gritty, we have your 3 urology rotations. So the University of Chicago itself is down in Hyde Park, which is on the south side down here of Chicago. This is the main hospital. That's actually our new CCD center, which just opened about, I think 8 or 10 years ago now. And that's the main, this is our outpatient center, and Comer is right here. So our overall center, we have the University of Chicago, which, as I mentioned, is down in the south side of Chicago. We actually go to the Jesse Brown VA hospital, where we work with Northwestern residents and colleagues and attendings, which I think is a great opportunity to cross-pollinate, if you will, and learn new techniques and surgical skills, and collaborate with another residency program. And then we have our North Shore Hospital system, which is on the north side, which is an operative only rotation. There's no clinics, and our residents love their time there. As Dr. Shaw mentioned, I think it's a real strength of our program. I can't imagine that there's a better private practice experience anywhere in the country. We're very fortunate to have them with us. Our PGY1 intern year, you actually do 5 months of urology. So there's 4 months with us on the main campus. There's a very wonderful 1 month of urology at the VA, where you do prostate biopsies and cystoscopies. You're the main procedural resident there. And then 6 months of general surgery. And 2 weeks, 2 times 2 weeks of vacation with some of the general surgery rotations. Our PGY2 year is focused on the adult and pediatric main campus, which is focusing mainly on endoscopic and laparoscopic procedures. A PGY3, there's 4 months at the main campus, 4 months at the Jesse Brown VA, and 4 months at North Shore. And during this year, you're going to start focusing more on advanced surgical procedures and increased independence. Our PGY4 year has 4 months of pediatric urology, 4 months of adult urology, and 4 months at the VA. And again, you're really going to be doing more advanced robotic, laparoscopic, and open surgeries during this year. And of course, our PGY5 year, our chief year, there's 8 months at the on the adult urology service, with 4 months of those as the Uber chief, and then 4 months at North Shore. And this is the time where you're really be honing your surgical skills to be able to do some of the most complex urologic procedures, and you're responsible for overseeing all aspects of the urology service. So we've completely redesigned our urology conference schedule. So it's a faculty-led topics-based curriculum now. We have monthly M&M, and then weekly grand rounds with faculty invited guest lectures. And during this, we are having coffee and light breakfast as well. We also are including educational topics such as implicit bias lectures, mentorship and feedback lectures. So we all learned how to educate and how to give feedback so we can really optimize education, and statistics and research lectures. We're going to have a monthly based journal club with the faculty leader for that month, who is going to be leading the journal club in that topic for the month, and that'll be over dinner together. And I think some of those will be at some of the faculty's homes as well, which I think is a real nice way of bonding. And then our weekly lectures, we have Campbell's plus a faculty lecture every week where dinner's provided. And then we're starting to do built-in case-based presentations at the end of a topic at the end of the month, which will help with formal oral boards prep and kind of help you to review that you know the topics that we just went through. We also are starting to do formal oral boards prep in the springtime for our chief residents. We have a weekly conference and a monthly stone conference with our nephrology colleagues. And that's led by Dr. Koh, who Dr. Shala mentioned is one of the world leaders and experts in metabolic stone disease. So it's a real opportunity to learn that area of urology. This is just an example of what our current schedule is by the months and who our faculty leaders are. Another area that we're implementing this year, I'm very excited about this, is a new urology wellness curriculum for our residents. So included in this is we're working on doing a half day off for, make sure every resident has a half day off for every month or every other month for wellness. And that's not a post-call day, and it's so you're able to plan to make, you know, dental appointments or doctor's appointments, or get your oil change for your car, because we recognize that not a lot of things have to be done during weekdays, and it's to really enable you to be able to have time to take care of the things that you need to take care of. We're going to be doing a resident retreat that starts in the summer We're hoping to do a yoga class and a community outreach service event. We'll be sponsoring 3 resident outings a year, and that'll where the fellow has graciously agreed to cover the pager. So all of our residents will be able to attend, which I think is really nice. And then as a department, we'll be doing urology summer events, and then we have our holiday party and spring event. And then we're also going to be providing surgeon life coach sessions, about 4 of those, because looking at the literature, it seems like that's one of the few actual ways that really helps with resident wellness. And I'm really excited to see how that goes and pioneer that. Some other things that the residents have requested we're doing are snacks for the cave, which is our main workroom. As I mentioned, some bringing back dinners for our didactics and some breakfast with our grand rounds. Our GME also provides lunches and dinners for our residents, and there's perspectives for mental health and wellness, which is for all of our residents at University of Chicago. Some of our new residents resources that we've brought in, we have faculty mentorship program now where the residents select a mentor during their PGY 3-year so that they're really able to find a mentor who they engage with and have a good relationship, but also who could help them on their career path to finding their future jobs or their fellowships. We have a newer floor PA and a new bedside assist, so we can really focus on getting our residents on the robotic consoles, and also APPs in clinic. The books that we replied are Campbell's and High Yield Urology, and we do get SASP questions for all of our residents. So it's just an app, and you can be doing them on the go, which is a great way to prepare for written boards. And they all have access to the AUA update series as well. We of course supply their AUA membership, and then all of our residents get loops during their PGY 1 year. And we have a new cysto cart with disposable scopes, which hopefully is making that much easier for our residents as they go about their work on the floor. We have offsite mileage reimbursement for residents who are going, say, to North Shore, where there is a bit of travel. We have a newly created robotics curriculum based out of North Shore that our residents put together, which is great. And we've had some cadaver labs that we're working on. We also have educational conferences. So I'm actually very excited about this. We sent our PGY2s, I think it was in July, to a brand new AUA Fundamentals in Urology course, which I think is a great opportunity to learn urologic knowledge. But I also recognize that without in-person interviews, that as a group, I feel like there's great connections that are made during the in-person interviews. And I really want our residents to have our opportunity to meet residents from other programs early on, because that becomes your future network. And then we do have our, in June of PGY 5-year, our chiefs go to the board review course. For research resources, we've really expanded this, and I'm very excited with where things are going. Dr. Egner actually has a urology specific grant to perform randomized controlled trials. So I think there's 3 ongoing, and you can, if you have a good trial you want to do, you apply and for this grant, and we have funding for that, which is very exciting. We have Dr. Scolaris starting with us as the new Director of Health Services Research, and he'll be working, and hopefully there's going to be some nice resources coming in with that. And he'll be working with Dr. Modi to be doing those projects through MarketScan and other databases. We have an amazing collaboration for research. So if you're interested in oncology, we work with our oncologists on a number of projects, and Dr. Reynolds is working with our nephrology stone group on projects there. And so I think there's a real opportunity at the University of Chicago if you're interested in research to collaborate. The Department of Surgery has a new research department in it as well, with new statisticians for statistical support. And there's actually phenomenal research support at North Shore, where I think they have Sear Medicare and statisticians to help you do any sort of research projects you'd want to collaborate with them as well. Within our didactics, we'll be doing a biannual research consortium to discuss ongoing research projects and make sure that we all keep updating and help to figure out how we can engage residents with different projects and areas that they're interested in. If you have research projects to present, we do cover travel to a meeting a year with potential funding if there's additional conferences you're interested in going to. And at the end of the year, we're reinstituting our Schoenborn research competition for our residents research projects where there's a monetary prize. To give you an idea of our graduating residents, we've had 30 in the past decade or so going into fellowships, and you can see the distribution here with most going into female or reconstructive fellowships or oncology. And then about 10 of our residents have gone into private practice. And just to give you an idea, it's pretty amazing the private practice opportunities and fellowships our residents get. So a number of our residents have stayed in the Chicago area to work with, say, Loyola or the DuPage Medical Group. We also recently had a resident who's just graduated. He's going to Kaiser out in Seattle or working in Oregon. In California. So our residents aren't limited to the Midwest. They're really able to get great opportunities all over the country. And for our fellowships, they've done a number of fantastic fellowships. For example, minimally invasive, a number have done that at USC, MD Anderson. We've had multiple go into the GRS fellowships recently at Duke and at UCSF, and are now on faculty at places like Brigham and Women, Johns Hopkins, WashU St. Louis. We've had a few do the wonderful Lingaman Fellowship to learn HOLIP, and they're now pioneering those at their respective institutions. And then we've had some do the FPMRS at UT Southwestern at Vanderbilt, and they're now on faculty at university centers as well. So we're very proud of our graduating residents. And as you can tell, they really typically get their first choices for both jobs and fellowships, and again, are incredibly well trained. I'm about to wrap up, but I'm a very proud Chicagoan, and I think it's one of the best cities in the world. It's just an amazing city. It's right on the waterfront. We have world-class museums, 200 plus theaters. It was Bon Appetit's Restaurant City of the Year a few years ago. The number of restaurants is fantastic, and if you ever want suggestions, your faculty love to dine out, so we're always happy to give them. We have 31 miles of lakefront, so if you get the courage to ride with Dr. Shalov, who, by the way, is an multiple Ironman triathlete and also has run the Boston Marathon. He's going to have to correct me 7 or 8 times. So he's a great athlete, but if you ride with him, this lakefront, I mean, it's just amazing. I actually live right here. This is my view over Belmont Harbor, if you can imagine. So it's a wonderful place to live, a wonderful place to play. We have 2 airports, easy access. People travel all over the world, including our residents, COVID notwithstanding. So I hope you really consider us for our program. We're very excited about all the changes we're making and the what our residents are capable of coming out. On that note, I am going to pass it along to our residents so you can get their perspective. And thanks for joining us.
All right. Hello, I'm Clark. I'm one of the PGY 6s.
Clark, can you let me just make 2 remarks?
No.
I forgot to
yeah,
do it
go ahead.
just very quickly. One, it's not all flowers and joy. Realistically, PGY 1 and 2 are difficult times. You go to the grind, but this is again part of the excellence of this program. You are, tested in fire, and when you go out there to life, you're ready for anything they can throw at you. So the 2 first years are very challenging, especially the PGY 2. So this is something I wanted to mention, to kind of balance the beauty of this program. The other thing I want to mention is that the best knowledge of a program you can achieve is one-on-one with residents in the program. The more time you spend with the residents, talking to them and hearing from them without the bias of the attendings there, is the best thing you can do to learn about programs and decide where you want to go. So in that note, I will say goodbye and let you spend time one-on-one with our residents. Thank you guys for coming today.
All right. Well, I have a PowerPoint here. This is a little briefer and a little more casual. Where is it? There it is. Whee! All right. So again, my name's Clark. I'm a PGY 6. We used to be a 6-year program, if you're a little bit confused, and saw that we only are a 5-year program now. So I'm kind of a dinosaur, I guess, in that there's no longer going to be PGY 6s. I'll call him back. Dr. Ferris went over this, but briefly, there's 5 years. PGY 1 year, it's kind of half urology, half general surgery. You do 1 at the VA. PGY 2 is all at U of C. You get very close to your classmates. And we're kind of doing these rotations where 4 of the months you'll be in the OR mainly, 4 of the months you'll be in the clinic mainly, and 4 months you'll be kind of flexing back and forth as needed. In the PGY 3 year, you go to 3 different sites. PGY 4 year, you're doing peds, you're doing the adult service, and you're also at the VA as a senior resident. And then in the PGY 5 year, you're a chief at North Shore and at U of C. And then for 4 months, you get to be the kind of secondary chief and not have to make the schedule. Call schedule. This is something that people all care about. When you are a junior resident, there's 4 of you at U of C. So it's basically Q4 call. It is home call with basically post-call days in the morning because often, you're working throughout the night and just getting, some sleep here, some sleep there. The weekends, you get 2 off basically every month, every other one on average. And you always have a senior as backup. So the senior call, there's 2 PGY 5s, 1 PGY 4 who are on call with the juniors. They don't carry the primary pager, but they answer questions. And whenever there's like an advanced procedure on the floor, or certainly when someone's going to the operating room, they come in, and then they take call for like a whole weekend at a time. So you have more weekends off. At North Shore, you have every weekend off because it's covered by moonlighters, which is something I'll talk about briefly later because we are part of the moonlighting crew. So basically you take 2 calls per week, 8 calls per month, and you have every weekend off, which is very nice. It's very heavy operatively, so it kind of feels like a sprint during the weeks, and then you can relax on the weekends. At the VA, you're on Q3 call shared with 2 Northwestern junior residents. But believe it or not, it's the easiest of the calls, kind of by a lot, just because it's not that busy. And then you take call every 3rd weekend, just like the weekly calls. It's the easiest junior call, and the senior call at the VA, as you'd imagine, is also quite easy. There's only 2 of you, so you're doing it every other day, but they basically never need you, which is great. So moonlighting at North Shore, so starting at 6 p.m. on Friday, going until 6 a.m. on Monday, moonlighters cover there. It's generally us and Northwestern residents, and then sometimes like a Chicagoland fellow from Northwestern or Rush or Loyola or something. But basically, you just need to have completed step 3 and have a permanent Illinois license, and then you can do it. They pay you about, I think after taxes, it's like $800 for a 12-hour shift. You get time and a half on holidays, and it's really nice for the residents. So that's like a nice little boost financially, especially because it's a job that you are quite good at doing because you do it all the time anyway. Oh yeah, thumbs up, it's good. So these are our residents. We had to update the map recently because we just had someone from the Pacific Northwest graduate. But as you can see, there's a lot of people from the Midwest, Michigan, Wisconsin, Indiana, Illinois, Missouri. some California, as I would say is probably usual for any place in the country. We do have Trinidad and Tobago. That's a new one. And then some East Coast. So there's some geographic diversity. And how could I forget Oklahoma too? Good old South. All right, now just some pictures of stuff that we do. As Dr. Shalhoff says, there's a lot of biking. The faculty like biking. This is David Nussbaum. He's a PGY3. He also likes biking. Johnny Lindquist, who just graduated, was a big biker. They meet on like Saturdays and Sundays at 6 or 7 a.m. and just kind of bike along the lake, which is fun. Fun way to start a day, weekend day. These are the half marathons that Dr. Shalhoff is tongue in cheek saying he won't graduate if you don't do it. He does want you to do it, but I think legally he would have a lot of trouble trying to not graduate you for that. They're pretty fun. It's a good team bonding event. I think people go out to dinner the night before, have some carbohydrates to load up on. We have pets. It's a lot of cats, as you can see. I haven't done a count recently, but we have 17 residents right now, and I bet like 9 of them have cats or something. Here's one of our, this guy just graduated. He had 2 cats. He would sleep with them all the time. Some people do have dogs. So we're not like a cat only program, if that would be a turnoff. And the dogs are quite cute, as you would imagine. So we like to go out to eat. We eat in our call room quite a bit too. Kind of eat wherever, restaurants. This is I think one of the faculty took us out here. This is a pizza place in Hyde Park. It's pretty nice. And that happens periodically too. Dr. Modi is especially fond of taking us out for like pizza and beer or something. There's a lot of travelers. So, when we take vacations as an intern, you actually get 2 weeks at a time. And then otherwise it's like 1 week at a time with flanking weekends. So people get aggressive and they travel internationally or they go on big hiking trips to like the Mountain West or Grand Canyon area. We like to dress up. These are graduation pictures. I like to dress up in costume, less appropriate at formal events. We also like to dress down. This is Lollapalooza, which happens every year. That's another benefit of our program. Everyone lives within walking distance, if that's your kind of thing. Pose for photos. There's a lot of photos of us, kind of from around town. A few of us have kids, so it is possible, although I'm sure daunting to those who have them. They make it work. It's very impressive. We work together with these nice fresh white coats, probably only been worn 1 or 2 times. And most of all, we like each other. This is post interview dinner at a pizza place. It was very fun. That was a good night. So anyway, that's what I got. I'll stop my share. And oh, look at that. We kept it right to an hour.